So President Cyril Ramaphosa has decided to keep the country on lockdown alert level 1. The president addressed the nation just last night amid rising infections as well as the discovery of a new variant, Omicron is what it's called. Now, he further expressed his disappointment with the travel ban imposed by the UK and several European countries on South Africa as well as its neighbouring countries. Let's get some reaction now to this as well as the president's address. Joined by health expert Dr. Fundile Nyati. Thank you so much for your time, Dr. Nyati. Always a pleasure to talk to you. So the president obviously not moving the country to alert level 1. Did this come as a surprise? Because Gareth and I were just saying that there seemed to be a bit of, concern and discomfort that perhaps the president, based on the numbers we're seeing right now, might move the country to a much more stricter lockdown level.
Well, thank you, for the interview. I think the president and whoever is advising him in that NCCC, they really looked at all the facts before them. Yes, after the announcement of the new variant on Thursday, which I think could have been maybe announced a little bit better, there was a lot of panic across the world, but even here in South Africa. So people were actually expecting the worst. But the reality, though, is that as a country, the total number of cases at this moment, people who are positive is less than 20,000, nationally. And the highest number we've had was on Saturday at just about 3.2. That is the numbers per day. Yes, there is a trend that is showing that things are getting a little bit, towards a fourth wave, but we're not yet there. So they really had to balance issues of livelihood and issues of saving lives. And they were actually quite pragmatic in actually saying what we need most is the vaccination and less of the lockdown. Already from the announcement, the other countries have closed up on us. Yeah. So we can't also be the ones who actually close up our economy as well.
Dr. Nyati, I want to ask you about what the president spoke about in terms of that task team that he is establishing to look into mandatory vaccinations in the country. It's the same question we're posing to our viewers, but I'm sure we will get mixed reactions on this. We spoke to Busa as well about this. They are of the view that it's good for businesses. As a matter of fact, some businesses have already started applying, for implementing or rather, introducing mandatory vaccinations into their premises. What's your view on this? Would this be effective? Would this not almost make those hesitant to be more hesitant, feeling as though vaccines are now really being imposed on them?
Well, I think, in South Africa, we obviously are in a democracy. There's a lot of rights that each one of us, enjoy in our constitution. But rights go hand in hand with responsibility. We can't just be looking for rights and yet we are not responsible. Now, the responsible thing to do for every South African is to use that which is available to us at no cost, which has been proven to save lives, because the balance is between saving lives and the livelihood. So we now have a tool to save lives. Yet South Africans exercising their democratic right, which is not absolute, by the way, they choose not to vaccinate. Only a third has actually vaccinated fully. That's about 35% or so. And 41% who have had at least one jab. Now, that's not good enough when we were looking at 70% by the end of December. So the gentle persuasion cannot go on forever. And therefore, the mandates are actually the right way to go because people have not exercised their rights responsibly. And so I fully support the government in that direction. And in fact, like I said, within our constitution, it does allow for some rights to be overridden, if the limitations are justifiable and reasonable in an open and democratic society. So I fully support the president.
Yeah. I'm going to let you go in a few seconds. Before I do, though, you're a health professional, you're an expert in the field. Should people not adhere to vaccinating, the regulations, the hygienic calls in terms of making sure you social distance, you wear your mask, you wash your hands. What could, with the numbers that we're seeing right now and the imminent fourth wave, what impact could this have on health practitioners and, our frontline healthcare workers? Because I think at times we forget the immense amount of pressure that our hospitals go through when there's a wave and there's no, adhering of regulations or even vaccinations in this regard.
Well, the frontline healthcare workers are the ones who are really taking the brunt of all of these waves, because when one is just about to end, another one is starting. There has been no breathing space for frontline healthcare workers since March last year. And the hospitals, yes, now have got less admissions, they are less busy, but already we are preparing for, a serious fourth wave. So it is a major problem. I'm happy that we are giving boosters to the healthcare workers as part of the Sisonke too. But I think the general public in South Africa really needs to understand that we can't continue having these multiple waves. They need to do the right thing. And so really, let's use those non-pharmacological measures to play our role so that the healthcare workers and the scientists can also play their role. Together, we can actually move forward and deal better with this pandemic. But the way things are, where people are not using their rights responsibly, then we are in for a major problem, and we could see ourselves in the same space we were in December last year. But it's all in our hands.
All right, I'll leave it there. I appreciate your time this morning, Dr.